Good afternoon. Today I am joined by Marty Martinez, our Chief of Health and Human Services, and Justin Sterrett, our Chief Financial Officer. And I want to start by reminding everyone that we are on the second day of a heat emergency here in Boston. To help residents stay cool, our BCYF community centers are open as cooling stations today and tomorrow from 10:30 a.m. to 6 p.m. Throughout the day, please stay hydrated, drink plenty of fluids, especially water, limit outdoor activities, avoid the midday sun, rest often in shady areas, and never ever leave children or pets in parked cars. If you are headed to a large body of water, please make sure to swim only where lifeguards are present, use a buddy system, and always watch children near the water. Call 911 immediately if you are experiencing or know someone who is experiencing signs of heat exhaustion or may appear to be in distress. Now, let me give an update on COVID-19 activity in Boston and our response. Over the last several weeks, we have seen an increase in COVID activity here in our city, averaging 119 cases a day. The data also show that the vaccine is our best way to protect ourselves from this virus. Today, the average number of people with COVID in Boston hospitals is just 68. By comparison, the average number of people with COVID in the hospital in early May, as we began to reopen the city, was twice as high at 127. Today's average is well below previous rates, with an average of 400 people in the hospital in January this year and 1,400 people in April of last year. Even with the increase in COVID activity, we are well below the established thresholds for hospital capacity. Public health experts expect that we could be living with COVID for a while. This means we will see ebbs and flows of COVID cases, and we need to ensure that our hospital capacity, which is our capacity to save people's lives, remains below the threshold. The best way to do that is by getting people vaccinated. By working in partnership with hospitals, community health centers, and the recipients of the vaccine equity grants that we distributed, over 400,000 Boston residents are fully vaccinated. Our latest efforts have helped to narrow gaps in the Black and Latino community as well, with a 17 percentage point increase in the Black vaccination rate and a 23 percentage point increase in the Latino vaccination rate. We are making real progress, and I'm proud of the work that we are doing together. Today, nearly 68% of Boston residents have received at least one dose. We are a highly vaccinated city and one of the most highly vaccinated states in the country. I want to thank Chief Martinez, the Public Health Commission, and all of our partners who have helped to make that possible. Vaccinations are critical. That is why today I am announcing a vaccine mandate with vaccination verification or required testing for municipal employees. Our purpose is to protect our employees and the public, and our work is rooted in public health guidance and based on data and science. 2 weeks ago, when I announced our plans to develop a mandate, I made it clear that I wanted to engage our workers and build a thoughtful plan. Over the last 2 weeks, we engaged with cabinet chiefs, department heads, and labor leaders in discussion. Yesterday, I had the pleasure of speaking with many of the municipal labor leaders, and all of us share the goal of a healthy workforce. And we will continue to engage managers, workers, and unions in the coming weeks as we implement this policy. I want to thank Chief Sterrett and his team for their work. By the end of the month, all city employees, contractors, and volunteers will be required to verify their vaccination status through a secured, centralized digital portal. The portal will be designed to protect the privacy of our employees' health information. If employees do not verify their status as vaccinated, they will be required to enter a new mandatory regular testing protocol, which includes submitting proof of a negative test result weekly. There will be clear timelines regarding when to get tested, how to submit testing results, and when employees would need to refrain from coming into work. There will be centralized COVID testing locations, including here at City Hall, as well as additional locations throughout the city to help accommodate the new testing protocol. Compliance with this new policy will be phased in starting on September 20th with our public-facing workers who interact with high-priority residents, like children in K-12 schools and our seniors, October 4th for all public-facing employees, and finally on October 18th for all city workers. All city workers will be required to comply with this new mandate. As the CEO of the largest employer in Boston that employs 18,000 people, we have to do all we can to protect ourselves, our families, and the residents we serve. In Boston, we are leading by example, and I continue to strongly recommend wearing a mask indoors and getting employees vaccinated. There are a number of mobile vaccination clinics available in the coming days, including the Islamic Society of Boston Cultural Center tomorrow, Dudley Cafe and Dorchester Emmanuel Church on Saturday, and Brado Brewhouse in Brighton, as well as our Open Newbury Street event on Sunday. We will continue to bring vaccination clinics to every neighborhood and focus on the gaps to ensure our most impacted populations get access as well. As we have seen over the past year, when we trust the science, track the data, and work together, we can help to keep our city and her residents safe. Thank you, and now I will open it up for a couple of questions.
But you are supporting a city employee mandate for vaccines. And how do you square that? Where's the line?
For our employees, there are 18,000 employees, and we are the largest employer in the city of Boston, and it's so important that we do everything we can to protect not just our workforce, but the people that we serve. We encourage other employers to do the same. When it comes to customers, residents of our city, many neighborhoods that still have lower vaccination rates than others, or populations that still have lower vaccination rates. What it is important that we don't do is lock them out. We continue to prioritize them when it comes to the vaccine. But to suggest that half of black residents couldn't go to a grocery store, I think is insane. So instead, we are prioritizing them, meeting them where they are, partnering with our community health centers, with all of the partners who receive the Vaccine Equity Grant. We are investing in people and programs that work. We want everyone in our city to get vaccinated, and it is so important. This is our best hope at beating this pandemic. I encourage others to follow suit and do the same for their workforce, but there is a big difference between a workforce and customers who need daily services every single day and count on going to the grocery store, to the gym, to libraries and other things in our city. We continue to prioritize getting folks vaccinated.
Folks who choose not to get vaccinated, those city employees who choose not to, and will have to submit regular testing. Who pays for that testing? The city pays for that testing?
We are making every effort available to get folks tested or vaccinated here. As the City of Boston, we'll make sure that employees have the time to do so, and we will make sure that our workforce is protected.
So the city is planning to just to clarify, the city is planning.
We are going to invest in people and programs that work. We will make sure that our workforce is protected.
Mayor, so you mentioned grocery stores and libraries, and some of your opponents have said that's ridiculous. We're not talking about grocery stores. We're talking about theaters or big concert halls and things like that. Might you consider that mandate?
So what I would say is I am not going to politicize the pandemic. I'm going to continue to prioritize people in our city, people who need the life-saving vaccine to make sure that we can all thrive and beat this pandemic, to make sure that we can get past COVID-19. We may be living with this for quite some time. What I have done from the very beginning is follow the data and trust the science. Should we get to the point where we need to do that in large venues, then I will absolutely do that. But what I will not do is politicize the pandemic. I'm going to prioritize people.
What about
Thank you very much.